Good evening, ladies and gentlemen. This is James of the Brew Show. James Brew and Lisa of the Brew Show. I'm being extremely formal. And you can see me with two very beautiful ladies. But I'm telling you in advance, it's not just about the beauty here, it's about the brains and about the love they have for the general populations in the world and trying to make the world a better place. So I'm here with Emily and Deborah. Ladies, how are you doing?
Yeah,
Doing great.
well,
And I don't want to tell you why we're here. I want them to say. So, who wants to go first? Who wants to tell us where we are and why we're here?
I can introduce that. So my name is Emily Sheldon. I'm the co-founder and CEO of the African Health Innovation Center, which is where we are today. We are an innovation hub based here in Osu that focuses on using innovation and entrepreneurship to improve health outcomes. And today we're really excited to be having a workshop focused on HIV/AIDS prevention, care, and treatment, and having conversations with everyone from community members to clinicians about how to improve health and how to reduce HIV in our communities.
Nice. And I can say that HIV/AIDS is still a heavy stigmatized thing. You see that people don't want to open up about it. In your experience, how has it been trying to one, acknowledge it and to dispel the stigma or help dispel the stigma?
okay, so in my experience, one thing I've come to realize is that it's because the stigma is still out there because most people are not well educated about HIV/AIDS. Most people think it's a very dangerous disease and that it can be even transmitted through contact, personal contact. So some people tend to shun those who have HIV/AIDS. But I'm here to tell you today that everyone with HIV/AIDS, once they start treatment, can be like us. That's why we have the U equals U. Once they start their treatment, their viral load goes very low, and they can also become like us, normal citizens. They can engage in sexual contact with their partners, and they become just like us. So I believe it's all about the education. When people have more information, the stigmatization will go down.
And when we say U equals U, what we mean is that undetectable equals untransmittable. When you regularly take HIV medication, the amount of virus in your system becomes so low that it can't even be detected. And as long as you continue to take your medication, we know that you are no longer able to pass that virus on to anybody else. So U equals U is really important for the general population to know about because it decreases the rate of infection of HIV and it makes it a safer and healthier world for all of us. And that's part of what we're here talking about today.
I think most of the people who will benefit most from this will be pregnant mothers who either have HIV themselves or are making a baby with a partner who has HIV, which means the baby wouldn't be infected in any way, right?
Yeah, when we talk about, in public health, we call them serodiscordant couples. Couples where one partner is positive and one partner is negative. For a long time, that's been a very risky situation. But now we know that if the partner who is positive is regularly taking their medication, they can have a very healthy sexual relationship with the negative partner and build a family, have children without the risk of spreading the infection to their kids. It's really exciting and monumental when it comes to the HIV conversation.
So, with regards to raising education, this is the first time we've had a workshop here at AHIC.
Well, at AHIC, we're really privileged that we get to travel all around the African continent to talk to people about sexual and reproductive health and rights. So we've run SRHR and HIV/AIDS workshops in Ghana, but also in Malawi, in Kenya. We've worked with groups in Liberia and a lot of other countries. But our physical space here just opened 4 months ago, and it's our first HIV/AIDS workshop to be held here on site, and we're so excited to host it and also to welcome so many more workshops in the future. Yeah, it's a landmark event.
Likewise.
Congratulations.
Thank you.
How often should we expect more workshops to be happening for us in Ghana?
You know, we cover a lot of different issues at AHIC. Sometimes we're talking about HIV, other times we're talking about pharmaceuticals, digital health, biomedical engineering. It's really, really a huge area that we cover. Anything that's at the intersection of public health, healthcare, innovation, and entrepreneurship. So hopefully in the months to come, you'll see several events popping up now that we've really opened our event space. And really those events only matter if people like you are joining, if people from the community, if clinicians and patients and family members come to say that they want to have conversations about health and about innovation.
Debbie, before today, were you in contact with AHIC?
No.
So how's it been for you?
It's been very amazing, and I've learned a lot today. Like the information today, like was really helpful to me, and I know it's going to help me in my practice out there. I'm yet to start my practice, but I know all the information I've gathered here and the experiences people have had with patients, and everything here is going to help me with my practice. And I believe that patients out there, clients out there are also going to benefit from this. And my colleagues who were not present today are also going to benefit from it because I'm going to share with my colleagues who are not here too. So all I want to say is that the future is bright for HIV/AIDS. So do not stigmatize. They are just like us. Thank you.
I like the diverse technique. So I'm going to leave you with two last questions. One, is there any hope about eventually finding a cure for HIV? Because I know that's something that has really been present in people's hearts and minds. And two, for those who may have it but are too scared to one, acknowledge the fact that they have it because they need to get tested. And two, when they do get tested, share with their loved ones and let them know they have it. How do you advise
So what I would say is that science is changing every day. Healthcare is changing every day. What we know is constantly transforming. And what we knew about HIV 10 years ago is so dramatically different than what we know about HIV today. So will there ever be a cure for HIV? I can't give you that answer. But what I can say is that what we know, how we treat, and how the disease is changing and transforming is different every single day. And I think that there's a very bright future ahead for looking at how we treat the condition from a chronic perspective, how we prevent it from spreading, and also hopefully someday being able to cure it completely. I also think that it's just important to think about, looking at HIV as a chronic condition, similar to diabetes, similar to other areas that we need to address. With proper medication, with proper treatment, with proper diagnosis, you can live a very happy and healthy life. And that's one of the big scientific changes that's happened in recent years. So people feel a lot of hesitation because they're thinking about the HIV from 20, 30 years ago. Now, if you get tested, you take medication, you can have a viral load, an infection rate so low that it's barely even detectable. And as long as you continue to take medication, the same way somebody might for their blood pressure, you can continue to live a very healthy and successful life.
Thank you so much, ladies. And seeing as we are in AHIC, how can people find you here? And how can you find you offline? So like offline is here, so online doing social media.
Yeah, the African Health Innovation Center, we are based here in Osu, Nyanyeva Estates, close to Laboni Junction. We do have special events, so if you go online and you follow us on Instagram at African Health Innovation, or you follow us on Facebook at African Health Innovation Center, you'll find out about all of our different events, and our website is www.africanhealthinnovation.org. So we hope to hear from you soon. Follow along. We've got a lot of exciting ways to engage.
Oh no, and I think if you want directions here, you could also use Google Map.
It's true.
You just type in the African Health Innovative Center on Google Map and it will bring you here.
That's what I did for once Google Maps. I'm happy to say a way. Debbie and Emily, thank you so much. And I'll keep in touch and I'll keep coming for more events.
Wonderful. Thank you so much for coming today. And thanks to all of you for listening to this message about health innovation. We hope to see you soon.
Thank you.